During the COVID-19 pandemic, Dr. Tooba, Kazmi, and Patient Services Manager Lauren Thayer were asked to create a new unit to take care of chronic ventilated patients. Their unit achieved record results in terms of the number of patients who were weaned off of ventilators. Going through the Connection Culture workshop, they had an aha moment about why their unit was so successful.
My name is Lauren Thayer. I'm a nurse manager on a pulmonary progressive care unit and a general medicine unit at a large major health system here in the state of Connecticut.
Tooba, Kazmi. I'm the MD lead partner of Lauren Thayer here, just organizing day-to-day functions. That's it.
The backbone of the operations is Dr. Kazmi, really. But this was a great experience, I think, for both of us to be able to go through this training, and it really made us more aware of the connection that we had as a nursing and provider-driven connection, and how that really impacts the entire team of staff up on the unit, whether it's our providers, our nurses, and how that connection that we have really impacts the patient care that's delivered and our patient outcomes.
Right. When we were already doing it, and when we took the course, we realized the right things we were doing. And I think it is important to know the right things you're doing, so you not only continue doing it, but do it more and better. The course really resonated with us as a team because it was an aha moment. I still remember, the types of cultures you explained, the vision, the value, the communication skills that is needed to create such a culture. When I heard that, it was kind of, we looked at each other, I still remember, we looked at each other, I was like, yeah, that's why we have better outcomes. And it was not only validation, but also identification of what we are doing right, so we can build on that. When COVID started and we needed a unit, like Lauren said, it's a progressive pulmonary unit where chronic ventilated patients could be taken care of. It was a unique idea and an experimental floor. So when we were called to make a floor like that, it automatically gave us a value system, a mission behind which we could come together, not just me and Lauren, but also our pulmonary attending, who's another partner, and a PA attending. Peer leader, physician assistant leader. So the four of us wanted to create an environment where we not only take excellent care of people who are chronically on ventilator from COVID and other diseases, but also maybe able to wean them off. And what we saw, the nurses gathered behind us, the MDs gathered, and we were able to wean them off in record numbers. And it wasn't until we went to the course and we were just sitting and you guys were explaining, it's like, yeah, right, that's how we did it. And the importance of knowing how we did it is we can replicate the same process we did to another unit, maybe for another cause, and have other great outcomes. So
I think part of the success is the relationship that we have. We were able to recognize through this course that communication is the foundation of everything. Having that open door policy where we are easily accessible to one another, easily accessible to the staff on the floor, it makes a huge difference in this process and the success of an environment as well. To really be able to rely on each other and know that the other person is always there, regardless of the time of day of week, that we're always there to be able to meet those needs.
In person and through phone or however it's possible. Coming back from that course, it became even more important to kind of empower my MDs and PAs to sit in that room, the room that I showed you guys, and be available for nursing. It's not about the text, it's just like this face-to-face communication. We value face-to-face communication, which improves. We value knowing the names, little things I learned from that, knowing the names of your staff, knowing their personal background, right? For example, we just talked about Margaret's father is a physician, and knowing
one of our care coordinators,
right, and knowing that where does Lauren come from, or what are my unique cultural backgrounds that made a stronger bond. We appreciate that more.
And with all of our differences, those all add to different strengths on the team as well,
Yeah.
Which we really move forward, which is, contributes greatly to our success and the success of this unit.
Right. And then specifically when there is a problem, I think that having that bond where there's maybe a sick patient or a family member who's not seeing eye to eye or needs more of our attention, we can all come together and we have that energy to give it to them, because we're not constantly trying to figure out each other. We already have that. So the energy is there to take care of the difficult clinical cases, sick patients, grieving family members, and to be there for them. When there's a conflict, and I've been in cultures where, if this Lauren and I are not working together, you don't have that energy. Most of the energy is spent taking care, pleasing, or getting over a conflict. I think one of the strengths is that we are more friends up here, and we like it like that.
Absolutely. We have a common goal, and our common goal is, our patients, our patient outcomes, doing whatever we can to improve the environment for them, getting them back home to their family members, and having that common goal and something that we're both striving to accomplish really goes a long way with the success and just how well we work together.
Yeah. I want to specifically point out for Lauren, she's very modest, she wouldn't say it. I really appreciate it. So I'm not American, I'm still trying to understand which are holidays, which are not holidays, which are public holidays. That's my problem. And I know I've called her on public holidays, and she's picked up, she's answered my emails, and after only half an hour and everything has been solved, she goes, yeah. And I would say, Lauren, you're not at work today. Well, Dr. Kazmi, it is a public holiday, but it's a hospital said it's a holiday. I'm always available. And I really truly appreciate it, right? Most of the people would not even pick up your phone. She downplays it, but I want to 24/7. I think that's what I love about Lauren. Another thing is that there was like a difficult situation with a family member who were kind of treating the patient not the way the nurses would like to be treated or the patient would like to be treated. And the nurses don't say anything. They just come to Lauren and tell her, so they can still be the good cop and keep the relationship with the family and the patient. And Lauren becomes the bad cop and goes and always defends her nurses and relays the not so desirable kind of messages. So I greatly appreciate that about Lauren, that she's not just available for us, but she's also available for her nurses to play that bad cop. And I think that's why nurses, follow you and say, okay, we're gonna do whatever you want.
It's all about the teamwork and just knowing what we could do to contribute to the success and everybody's happiness. Yeah.
And I think another thing is our sense of humor. No matter what happens, at the end of the day, we're always laughing about what happened, how can we do better, and just at the end of the day, the question is that best for the patient care, and we'll do it.
It's a challenging environment. There's many challenging environments. COVID has been an ongoing struggle and battle and has brought a lot of challenges, especially with patient populations like this that require that chronic ventilation. But to find the pleasure or the laughter in any moment that we possibly can goes a long way. Yeah. It really does. It helps the whole team morale.
Yeah, we are not shy from laughing at each other, with each other.
Exactly. I laugh at Dr. Kazmi all the time.
Yes, like I don't know the public holidays sometimes. Yeah.
The Connection Culture workshop we led for Yale New Haven Health is based on our book, Connection Culture. In anonymous evaluations, participants said that they would recommend the workshop to their colleagues, that they gained valuable skills that they can apply on their job, and that the workshop helped increase their connection with their colleagues. Recent reports by both the U.S. Surgeon General and the National Academy of Medicine have both recommended that organizations cultivate cultures of connection. Our work applies to small teams and to large organizations, and I encourage you to prioritize and implement similar training programs to cultivate cultures of connection throughout your organization.